So the visual pathway. The visual pathways is the first neuron for the visual pathway is the rods and the cones, which contains the pigment that when exposed to light, which produce the electrical activity. At the posterior pole, there is macula, and the nasal to it, there is optic nerve. The cones which perceive the color are in the macula, and the rods are located elsewhere. The rods and cones convey the activity to the ganglion cells, which provides the axons that comprise the optic nerves, optic chiasma, and the optic tract. These synapses are in the lateral geniculate nucleus. This is the main usual pathway. Then the topical diagnosis of the lesions to the side pathway. The first topical diagnosis is the orbital and intracanicular optic nerve compression. As you can see in the photo, how is the compression working? The optic nerve can be compressed in the intra-orbital portion by inflammatory conditions of the orbit, such as idiopathic inflammatory pseudotumor and thyroid-related or orbitopathy (TRO). TRO is associated with increased orbital volume from extra-auricular muscle enlargement, particularly the middle rectus, and such occurrence is predictive in the compressive dysthyroid optic neuropathy, which is called as DON. DON could persist and occur simultaneously or even after the control of symptoms of hyperthyroidism, the presence of toxic hyperthyroidism, the ocular signs such as lid, lag, retraction, proptosis, and typical open sharing facies are present in addition to the systemic features. So, yeah, this is all about it. Then the next one is the compression of optic chiasma by pituitary tumors. So we can see in the CT scan how it is. In the pituitary tumors have like both endocrine and ophthalmic manifestations. Pituitary adenomas represent 15% of the primary brain tumors, and the visual disturbances arising from the local mass effect on the visual system are common clinical manifestation. In some instances, more so in the younger patient, the vision is lost. Vision loss is more frequent, which is around 39%, followed by endocrine abnormality, which is 21%, and headache is among the 15% of the patient. The bilateral visual field defects were the more prevalent, which is around 41%. Common neuro-ophthalmic manifestation include blurred vision, impaired in color vision, relative afferent pupillary defect, optic atrophy, headache, and bitemporal field defect. Then the third one is the visual defects in the retrochiasmal pathway lesions. The brain tumors and aneurysm can affect the retrochiasmal visual pathways, giving rise to varied visual field defects. The optic tract arises from the posterior aspect of chiasma and extends posteriorly around the cerebral peduncle to reach the lateral geniculate body, LGP. It consists of cross nasal fibers and ipsilateral temporal fibers. Compressions results in the bilateral hemifield loss opposite to the side of the lesion. The homogeneous heminopia may be complete or may be incomplete, but encroaches as the nerve fibers from the corresponding retinal points are not closely related. The complete compression LGB similarly results in anemia, and we can see how the loss in the right side, and the next one you can see in the left side of the retina. Also, there is homogeneous hemanopia. You can see in the photo. Yeah.
Good. Please reconnect.
That's it. Thank you.
4 minutes because reconnect.